Bismillahirrahmanirrahim. Rabbi zidni ilma. Quote of the day: do what is right, not what is easy. Assalamu alaikum everyone. My name is Dr. Sadia Rafi, and under the supervision of Professor Dr. Sara Afzal, today my topic of discussion is National Health Policy 2001 and 2009. Learning outlines include the health policy formulation, health policy 2001 and 2009, policy standardization, recent updates, and multiple choice question session at the end. Learning outcome. At the end of this presentation, participants will be able to describe the health policy, different health policies of Pakistan, and also about policy standardization. Health policy. World Health Organization has defined health policy as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Harvard Medical School describes several categories of health policy, such as personal health policy care, pharmaceutical policy, policies associated with public health, such as vaccination policy, tobacco control policy, and breastfeeding promotion policy. Spectrum of areas covered by health policies include financing and delivery of healthcare, access to care, quality of care, and health equity. Talking about the policy cycle, it starts with the agenda setting, which includes the foresight scanning and identify emerging issues, then the formulation, impact assessments, then adoption, which includes the support and advice to regulatory bodies, then the implementation with the independent verification and the methodological guidance, then the evaluation, which includes evaluate efficiency and effectiveness, and last is support and maintenance, which includes the critical crisis response and feedback or updates, and this cycle goes on. Objectives of national health policy: to achieve an acceptable standards of improved health, ensure equitable access to public health system, create new health infrastructure in areas deficient, upgrade existing health infrastructures, promote public-private partnership, suggest way to increase investment in health, promote stewardship in health for effective monitoring and evaluation of current policies. Potential role of government in healthcare includes a regulator of healthcare policy, a stimulator of research, a protector of deprived group, a financer of health and healthcare programs, a purchaser of healthcare services, and a direct provider of services. Health policy triangle developed by Bob and Gibbs in 1994. Four elements of policy analysis are content, context, which includes why we need this policy. Content, which is the part, what is the policy mainly about? Then the process, how was the policy brought forward and implemented? Then comes the actor who participate in and influence formulation and implementation of the policy. You can easily see this triangle, which includes the actor, process, context, and contact. And it is more clear in the next picture, which is this. You can see the context. This is the triangle, which revolves around the context, the socio-political, cultural, and health system context within which the child and adolescent mental health policy was developed. Then the process, the key stakeholders, non-government sectors, and everything. Then the content, which includes objectives, values, vision, service models, guidelines, and implementation of the plan. And the actors are in the middle, the range and characteristics of parties, which includes individual, groups, and organizations. In the policy development process, including their roles, relationships, interests, agendas, and expertise according to their policy. Then the steps of health policy formulation. First is data collection from each health management information system, then the preparatory meetings, drafts and the planning commission, Ministry of Finance, then the cabinet, 5-year plan formulated, the projects design, public sector development program, implementation, monitoring, and evaluation. 5 basic criteria. The Bohar Committee report was discussed the appropriateness and accuracy of policy development, On the basis, Lashari in 2004 highlighted the 5 basic criteria the policy should contain. First is the empirical record of the past, situation and analysis, need assessment, future plan with implementation and estimates. Second is evidence-based relying on burden of disease through HIMS. Then address health system with intersectoral approach. Look into cost effectiveness of goal, objectives, and targets, and have a clear definition of roles of federal, provision, and district tiers. Formulation of health policy in Pakistan. Before 18th Amendment, process of Federal Ministry of Health and Planning Commission, and the planning and implementation was going in provinces. And after 18th Amendment, which was in 2010, devolution. And everybody knows the devolution means from the hierarchy, from higher hierarchy to lower hierarchy, there was a slab of power from central to local government. Then came the National Health Plan, and then the health policy is a function of provinces now. Talking about Health Policy 1990, Pakistan is signatory for Health for All. First, it was the first national policy. It focused on school health services, family planning, nutrition programs, malaria control programs, control of communicable diseases, sanitation, and safe drinking water. Then the Health Policy 1997. SAP, Social Action Plan, was implemented in 1992, multi-sector policy initiatives of Government of Pakistan. It was second national policy, health promotion and education, non-communicable diseases were highlighted for prevention and control measures. Health Policy 2001, to create mass awareness in public health matters and use multimedia to disseminate information. Omits prevention and control aspects of non-communicable diseases. Heart 5 2003 National Action Plan for Prevention and Control of Non-Communicable Diseases. Health Policy 2001, the way forward. The empirical record of past situation analysis need assessment not given. The evidence based relying on a board of directors was not mentioned. Address health system and intersectoral approach was not mentioned in it. The cost effectiveness of goals, objective, and targets. Cost effectiveness of implementation plan not discussed. And the last point was clear definition of roles of federal, provincial, and district tiers did not fulfill any criteria. This was the criteria which I described earlier. It has 5 points, and this was about the 2001 health policy. You can see many things were not mentioned and discussed in it. Then the health policy 2009. Draft was not approved. Step towards better health. VN was to improve health and quality of life of all Pakistanis to make progress towards health-related and Millennium Development Goals. Enhancing coverage and access of essential health services, especially for the poor, which includes the primary and secondary healthcare facilities, primary and preventive healthcare programs. Second was measurable reduction in the burden of diseases, especially among vulnerable segment of population. Then protecting the poor and underprivileged population subgroups against catastrophic health expenditures and risk factors. Fourth, strengthening health system with focus on resources. Fifth, strengthening stewardship functions in the sector to ensure service provision, equitable financing, and promoting accountability. The last was improving evidence-based policy making and strategic planning in the health. Health Policy 2009-10, empirical board of past, etc. Health needs identified, at least in this policy. Then the evidence-based relying on board of direction, evidence-based. Address health system and intersectoral approach, yes. Wider intersectoral coordination was mentioned. The cost effectiveness and goal, objective, targets, implementation plan, cost effectiveness, not mentioned. Then the clearly definition of roles of federal, provincial, district tiers mentioned, but district health system role not clearly defined. So it was better than the last year one, the 2001s. Health Policy 2010. It could not be approved because before devolution. It was post 18th Amendment in 2010. So the formulation of effective health policies. Literature support the effective health policies can be formulated by doing the following. situational analysis and policy formulation, increased funding, training and capacity development, community involvement, public-private partnership, stabilizing population, monitoring and evaluation, and transparency and accountability. National Health Vision 2016 to 2025. We will talk about this in detail tomorrow. Just a brief introduction. It was a background issue was partial implementation of National Policy 2001 and 2009 policies, many health issues, which include the burden of diseases, worsening of population exposure, and insufficient health system remain unsolved. Plus, new challenges created by 2011 health revolution, MDGs were not achieved and SDGs were launched. Punjab Health Sector Strategy. In this, it was mentioned the Health Sector Strategy 2012-20, and the Punjab Health Sector Strategy was from 2019 to 2028. It includes maternal and child health, nutrition and family planning, preventive health services, including communicable and non-communicable diseases, then the patient safety and the quality of care, health disaster, medicine and biomedical equipment, health disaster management and emergency medicine, healthcare finances and public-private partnership, health management information system, governance and accountability, and HR for human resource for health. So as it was after devolution, every province is responsible for their own policies. So first we have talked about Punjab, now it's about Sindh. The overall was based on health for all for the new health policy aims in implementing the strategy of protecting people against hazardous diseases, promoting public health, upgrading curative health facilities, enhancing equity, efficiency, and effectiveness in health sector. So again, the health sector's strategy of Sindh was with the name of Sehat Zindagi. And they have now, after 2020, it was finished, and with new things, it has been added and going on in Sindh. Then the health sector strategy, Khyber Pakhtunkhwa. After devolution, Khyber Pakhtunkhwa is the first province to develop a health sector strategy, which was from 2010 to 17. Entailing a responsive health system to improve the health status of the population based on priorities outcome. So Khyber Pakhtunkhwa was the first province to develop its own health strategy. And you can see the potential funding share of priority health development was 54% by the government and 46% from the donors. The health policy was prepared in the view of the key issue related to health status of the population, intersectoral coordination, priorities of current government and health sector, achieving health-related SDGs and universal health coverage, national priorities in health sector. Now the health sector strategy, Balochistan, which was from 2018 to 30. It was preceded by review of literature published as well as grade to establish policy context. The policy has been developed through a consultative process involving stakeholders and followed through that field visits, individual meeting with key informants, group meetings, and focus group discussions were held. The principles of the health policy were embedded in the National Health Vision and Sustainable Development Goals 2030. The health policy documents will provide direction and serve as a long-term plan for health system strengthening. Then the health sector strategy for Gilgit-Baltistan, it was from 2016 to 20 for 10 priority actions to address challenges of reproductive, maternal, newborn, child, and adolescent health and nutrition. So talking about the summary, the first policy was in 1990, then 1997, then 2001 and 2009. 2010 devolution occurred in 2010, and then the National Health Vision 2016 to 25 was come and with provisional policies. Policy standardization. Standardization in healthcare is often defined as a process by which healthcare products and services are chosen by the committee of key stakeholders considering evidence-based results to ensure quality patient care while adhering to fiscal responsibility. Standardization, especially in healthcare, minimizes the risk of error, increases patient safety, and can actually improve the patient experience. Berkeley's Public Policy Journal Plans are now sold through health insurance exchange, either set up by a state or run by the federal government. Instead of allowing insurer to offer a vast range of plans, standardization streamlines decision making to the benefit of both the consumer and insurer. Why standardization? Improving the consumer experience with Affordable Care Act coverage. The Affordable Care Act coverage created health insurance exchange in every state to encourage insurer to compete based on price and quality. The exchange were required to maintain websites where consumers could make apples to apples comparison among health plans. So it was its basic agenda. Now moving towards recent updates. Does an improvement in rural infrastructure contribute to alleviate poverty in Pakistan? A spatial economic critic analysis. This study aims to empirically analyze the impact of rural infrastructure on district-wise poverty in Pakistan. The analysis provides some important conclusions and policy implications for poverty reduction strategy in Pakistan. From a policy perspective, the findings suggest that the government should take appropriate measures to overcome energy poverty in rural areas, as more than 35% of rural areas in Pakistan have no access to modern form of energy. The government may have to ensure an efficient implementation of the National Sanitation Policy 2006 and National Drinking Water Policy 2019 to achieve the targets by 2025. Hence, the study may provide evidence informing the debate on the role of public infrastructure investment in developing countries. Another study was policymaker perspective about e-government success using its the hierarchical approach, policy implication towards entrenching good governance in Pakistan. This study fills the gap caused by paucity of literature in the terms of empirical-based techno-policy research in e-government domain from implementation perspective. Further, it serves as a prototype for the prospective researcher who aim to conduct policy-oriented research towards e-government development in their respective regions. This study contributes in several ways. It highlights the significance of e-government as a technology for attaining good governance in Pakistan. Further, it presents consolidation view of all the concerned stakeholders towards the successful implementation of all e-government programs in Pakistan. Finally, it provides a guideline for the government agencies to formulate their e-government policy and strategy as per the need of all stakeholders in Pakistan. Now, it's time for the multiple choice questions. Question number 1. The Health Minister XYZ wants to analyze the current challenges present in National AIDS Control Program and revise the overall policy. Which of the following option is the correct step-by-step pathway used for such policy analysis? A. Data collection from many sources and implementation of a health policy using scientific approaches to problem solving. B. Analysis of problem and policy to determine the best way to implement change. C. Assessment, planning, intervention, and evaluation of health policies and procedures. D. Identifying a problem, analyzing the policy and problem, developing the policy, implementing and evaluating the policy. E. Data collection from one source, analyze it with the help of statisticians and policymakers. D is the correct option, identifying the problem, analyzing the policy and problem, developing the policy, implementing and evaluating the policy. Question number 2. A teacher XYZ addressing to a group of students had an interactive session on the topic of health policy analysis. He asked the student to choose one best statement that describes a question one might ask in analyzing health policy. A. Who will benefit from this health policy? B. How can we implement this health policy? C. How has this health policy been utilized? D. Are there any changes that need to be made in this health policy? And E. Who will give the support to this policy? The correct option is B. How can we implement this health policy? Question number 3. A very key point in the process of COVID-19 contagion control is the introduction of effective policy measures, whose results must be noted continuously through accurate statistical analysis. When a dedicated group keeps continuous oversight of activities to ensure that they are proceeding according to plan, so they are doing monitoring, recording, planning, evaluation, or calculating. A is the correct option, monitoring. In an area XYZ, after situational analysis and need assessment, a public health team has developed a public health policy according to guidelines, during which one of the given phases most challenges are faced: public policy development, policy implementation, policy evaluation, policy monitoring, policy stakeholders. The correct option is B, policy implementation. Maternal mortality ratio is a key performance indicator for efforts to improve the health and safety of mothers before, during, and after childbirth. A public health professional team wants to design a policy to reduce maternal mortality rate in Balochistan. What should be done during first policy making? Need assessment, intersectoral coordination, financial approval by Ministry of Health, 5-year projects, and or implementation. The correct option is A, need assessment. In Pakistan, health system management and decision making has been transferred to district level, and EDO can hire, manage, budget, and serve provision. Which type of decentralization is this? Deconcentration, delegation, devolution, demographic dividend, demographic trap. The correct option is C, devolution. Question number 7. In Health Policy 2009 was made according to need assessment, address health system and intersectoral approach, and discuss cost effectiveness, goal, objectives, and targets. What was it not implemented in Pakistan? Lack of political will, international pressure, devolution, delegation, lack of community participation. C, devolution. Basic health unit serves up to 25,000 people with basic medical and surgical care, preventive services, maternal and child health care services, financial management of curative and preventive services. Our basic health unit in Pakistan is being managed by national level, provisional level, international level, World Health Organization, or by UNICEF. The correct option is B, provisional level. Neonatal mortality rate of Pakistan is 41.2 deaths per 1,000 live births. World Health Organization wants to sign an agreement that will help Pakistan to reduce neonatal mortality rate, as Pakistan has the highest NMR in the world. This agreement is a function of national level, provisional level, district level, union level, departmental level. A is the correct option, national level. Decentralization of health system has played an important role in health system of Pakistan. Which of the following is incorrect regarding decentralization? Improves allocative efficiency, improves quality, service deliveries according to quality, production efficiencies, and focus on adaptation. C, services deliveries. This is the key of my MCQ. And thank you so much.